Welcome back and thank you for staying with us. Now, another presidential health summit is being held, but we have so many challenges at hospitals. The latest report from the Chris Hani Baragwanath Hospital paints a historical and dire picture of our healthcare as the hospital struggles to feed patients and infant deaths are at an alarming rate. Now, President Cyril Ramaphosa is expected to lead the presidential health summit. Human rights and social justice activist and Maverick citizen editor Mark Heywood joins me now just to tell us what he thinks about what's been happening right now. So another summit, Mark, in terms of healthcare in South Africa, especially the public sector, nothing has improved. Do you believe that things like this assist, or is it just another talk shop?
Good afternoon. Well, I would wish that things like this assisted. Because the stamp of the presidency on fixing healthcare in South Africa is very, very important. But in 2018, a presidential healthcare summit was held, also drawing healthcare workers from all over South Africa. And in my view, very little of what was identified as the critical issues in that compact that emerged from that health summit has been achieved. Now, you could say that that is the reason for having another healthcare summit. I would argue that it's very, very obvious what needs to be done to fix our public healthcare system. And rather, we should be concentrating on doing the obvious things that need doing, about which there is no controversy, to improve the quality of care, to improve the outcomes of our healthcare system, rather than another expensive talk shop, which is what is happening. But given that the summit is going on now as we speak, it's taking place today and tomorrow, then the advice that I have given to those people who are attending is try to make it work. Try to make sure that the outcomes are absolutely clear and crisp, that we can monitor them, that we can have greater accountability, and that we can fix this health system.
I mean, looking at the report by the Chris Hani Baragwanath Hospital, this is a hospital that doesn't only feed the people of Soweto or even Gauteng. This is a huge hospital in terms of the African continent. So, when it comes to something like that being repeated, it's happened before that the hospital didn't pay suppliers, or the health department didn't pay suppliers, and food was not brought to the hospital to feed patients. Where does this really put us as a country when we can have a hospital that feeds the entire continent being affected like this?
Well, this is a case in point, which is what makes me question the value of the healthcare summit. It's a fact that patients have not had proper supplies of food in the last few weeks at Chris Hani Baragwanath. It's a fact, as was admitted by the MEC in Gauteng just a few days ago, that in 3 years, 900 babies born at that hospital have died of avoidable causes. Now, we've got to fix those things. And the reasons we have those problems are not complex and beyond us. They are to do with simple mismanagement, maladministration, and lack of support to the people who work within that health facility. I don't think that you need a 5 million rand summit to address that. And yet this is the biggest hospital, as you say, in the country. I think people would be far more trusting of these political meetings like this presidential health summit if they saw that there was the commitment on a day-to-day basis to fix the problems of the healthcare system on the ground.
And of course, this is an example only of one hospital. We all know what's been happening in other hospitals in South Africa, that, we see medical legal claims just skyrocketing in provinces such as Gauteng and the Eastern Cape. So a 5 million rand summit, maybe not. But what do you think experts and the health fraternity should be doing then to improve what we're seeing?
Well, a number of things. And they are not in any particular hierarchical order. The biggest problem, I think, is the management of the public healthcare system at the moment. Inefficient, often incompetent provincial health departments riddled with corruption. fix the management and make it focused on health outcomes, make it accessible and sensitive to what is actually happening in the healthcare system and the people who work in the healthcare system, then we will go a long way. That's one thing. The second thing is budgets for the healthcare system. We have been cutting per capita expenditure on health for the last 10 years, and yet the burden of disease in this country has been increasing. You can't treat more disease with less healthcare workers. A third thing would be effective health promotion in this country. We do very little on health promotion, and therefore we have many diseases that are to do with alcoholism, to do with smoking. We have problems of teenage pregnancy, which is escalating throughout the country. So we could limit the impact or what the healthcare system has to manage if we spend more money and better money on health prevention. And then we have many policies, many good policies on cancer treatment, on palliative care, which just don't have budgets, which are just simply sitting on paper and not being implemented. We need to audit those policies and have a plan to implement those policies. So, as you can say, I don't think anything I'm saying is controversial. It's not Mark Heywood's prescription as to what needs to be done to fix the healthcare
obvious
system.
Stuff.
It's what many people it's obvious stuff. And so what's preventing us from doing it?
Exactly. That's the big question. Hopefully they're able to answer that for us after the summit. Mark Heywood, thank you very much for speaking to us. He is Maverick Citizen Editor.